Imagine this. Tomorrow is the biggest exam of your life. You open your textbook, but your heart is pounding, your hands are shaking, your breathing becomes faster. No matter how hard you try, your mind refuses to calm down. Now, here's the question. Can one anxiety medicine fix this immediately, while another takes weeks to work? The answer is yes. Today, you'll learn the most important medicines used to treat anxiety, how they work, when doctors choose each one, and the key exam points you should never forget. What is anxiety? Everyone feels anxious sometimes. Before an exam, before a job interview, or before giving a speech. That's normal. But anxiety becomes a medical condition when the fear or worry is excessive, lasts for a long time, and begins to interfere with daily life. Some people can't sleep, and some constantly worry without a clear reason. Others experience a racing heart, sweating, trembling, or difficulty concentrating. When anxiety becomes severe, medicines may be needed along with counseling and lifestyle changes. But here's something many beginners don't know. Not all anxiety medicines work the same way. Some work slowly, some work very quickly. Let's start with the medicine that takes a different approach. The long-term anxiety medicine. Imagine a patient named Sarah. She has been feeling anxious almost every day for the past few months. She doesn't need emergency treatment. She needs something that helps control anxiety over time. This is where Buspirone may be used. Buspirone belongs to a group of medicines called serotonin receptor agonists. Instead of making the brain sleepy, it works on serotonin pathways that help regulate anxiety. Because of this, Buspirone does not work immediately. Patients usually need several days to a few weeks before they notice its full effect, so it is not suitable for panic attacks or situations where immediate relief is needed. One of its biggest advantages is that it has a much lower risk of dependence than benzodiazepines. However, there is one important BNF warning. If a patient has been taking a benzodiazepine for a long time, Buspirone cannot replace it suddenly. The benzodiazepine must be reduced gradually because Buspirone does not treat benzodiazepine withdrawal. Common side effects. Like all medicines, Buspirone can cause side effects. The most common include dizziness, headache, drowsiness, dry mouth, nausea, fatigue. Patients should avoid driving or operating machinery until they know how the medicine affects them. Alcohol can make these effects worse. Buspirone is generally avoided during pregnancy and breastfeeding. Extra caution is also needed in severe liver disease, severe kidney disease, epilepsy, myasthenia gravis, and angle closure glaucoma. Exam tip: Buspirone works slowly, has a lower risk of dependence, and does not treat benzodiazepine withdrawal. Benzodiazepines, the fast-acting anxiety medicines. Now imagine another patient. John suddenly develops overwhelming anxiety. His breathing becomes fast, his heart races. He feels like he's losing control. Waiting weeks for Buspirone won't help him today. This is where benzodiazepines may be considered. These medicines increase the action of GABA, the brain's main calming chemical. Think of GABA as the brain's natural brake pedal. When benzodiazepines strengthen GABA, brain activity slows down quickly. That's why these medicines work much faster than Buspirone. The 4 important benzodiazepines you'll commonly see in the BNF are diazepam, alprazolam, chlordiazepoxide, Oxazepam. Although they belong to the same family, each has its own important clinical uses. Diazepam. Diazepam is one of the most versatile benzodiazepines. Yes, it treats anxiety, but that's only one of its many uses. It is also used for acute panic attacks, muscle spasms, alcohol withdrawal, status epilepticus, febrile seizures, procedural sedation, tetanus. This is why diazepam appears so often throughout the BNF. Common side effects include drowsiness, dizziness, poor concentration, muscle weakness, confusion, fatigue. Because it causes sedation, patients should avoid alcohol and driving until they know how it affects them. Exam tip: diazepam has many clinical uses beyond anxiety, making it one of the most important benzodiazepines to remember. Next is alprazolam, also known by the brand name Xanax. Like diazepam, it works quickly and is used for short-term treatment of anxiety. However, because it can cause dependence, it is not recommended for long-term use. Common side effects include drowsiness, dry mouth, poor concentration, memory problems, constipation, appetite, and weight changes. Exam tip: alprazolam is effective for short-term anxiety but carries a significant risk of dependence. Chlordiazepoxide. Chlordiazepoxide is another benzodiazepine. It is used for short-term anxiety, but it has another very important role. It is one of the main medicines used to treat alcohol withdrawal. During alcohol withdrawal, patients can develop tremors, agitation, and even seizures. Chlordiazepoxide helps reduce these symptoms while the dose is gradually reduced. Common side effects include drowsiness, poor coordination, memory problems, increased risk of falls, movement disorders. Exam tip: think of chlordiazepoxide as the benzodiazepine commonly associated with alcohol withdrawal. Oxazepam. The last medicine in this group is oxazepam. Like the other benzodiazepines, it is used for short-term anxiety and anxiety-related insomnia. Its side effects are similar: drowsiness, memory problems, speech changes, dizziness, risk of dependence. Treatment is usually kept short because long-term use increases the risk of withdrawal and dependence. Exam tip: oxazepam is another short-term benzodiazepine used for anxiety and anxiety-related insomnia. Important safety warning. Now let's discuss the most important safety message from the BNF. Never combine benzodiazepines with opioids unless there is no safer alternative. Both medicines slow down the brain and breathing. When taken together, they greatly increase the risk of extreme drowsiness, respiratory depression, coma, death. Patients taking both medicines require close medical supervision. Another important point is that benzodiazepines should never be stopped suddenly after long-term use. Stopping them abruptly can lead to withdrawal symptoms such as severe anxiety, insomnia, tremors, hallucinations, seizures. The dose should always be reduced gradually under medical supervision. Other medicines used for anxiety. Although today's focus was Buspirone and benzodiazepines, the BNF also lists several other medicines that may be used to treat anxiety in selected patients. These include duloxetine, escitalopram, lorazepam, moclobemide, paroxetine, pericyaxine, pregabalin, trazodone, trifluoperazine, venlafaxine. We'll cover these medicines in future videos. Quick comparison. Let's make this easy to remember. Buspirone works slowly, lower risk of dependence, good for ongoing anxiety. Benzodiazepines work quickly, useful for short-term anxiety, can cause dependence, must not be stopped suddenly. Final exam tips. Remember these 5 high-yield facts. Buspirone is a serotonin receptor agonist and does not provide immediate relief. Benzodiazepines work by enhancing GABA and act rapidly. Diazepam has many important uses, including anxiety, seizures, muscle spasms, and alcohol withdrawal. Chlordiazepoxide is commonly used in alcohol withdrawal. Never stop benzodiazepines abruptly and avoid combining them with opioids whenever possible. And that's it for today's lesson on anxiety medicines. If you found this video helpful, please like, subscribe, and turn on the notification bell so you don't miss the next lesson in our BNF Chapter 4 Nervous System series. Also, share this video with your friends to help them learn too. In the next video, we'll explore attention deficit hyperactivity disorder, ADHD, and the medicines used to treat it. Thanks for watching, and I'll see you in the next lesson.